Colon cancer is one of the leading causes of cancer-related deaths in the United States. The good news is that early diagnosis through preventive screening often leads to a complete cure. Colorectal cancer starts in the large intestine, also known as the colon. Nearly all colon cancers begin as non-cancerous or benign polyps, which slowly develop into cancer. Screening can detect these polyps in early cancers. The great thing is that we can remove polyps years before cancer even has a chance to develop. Your doctor can use several tools to screen for cancer. The first step is a stool test. This test checks your bowel movements for blood that you might not even be able to see in your stool. Polyps in the colon in small cancers can bleed tiny amounts of blood that you can't see with the naked eye. The most common method is called the fecal occult blood test. A second method is called a sigmoidoscopy exam, and this test uses a flexible scope to look at the lower portion of your colon. But because it looks only at the last 1/3 of the large intestine, it may miss some cancers. That's why this test is usually done along with a stool test. A colonoscopy is similar to sigmoidoscopy, but it can see the entire colon. And that's why we usually do colonoscopies over sigmoidoscopies nowadays. You'll usually be mildly sedated during this test. Occasionally, your doctor may recommend, as an alternative, a double contrast barium enema, which is a special X-ray of the large intestine, or a virtual colonoscopy, which uses a CAT scan and computer software to create a 3D image of your large intestine. So, who should be screened for colon cancer? Well, beginning at age 50, men and women should have a screening test. People with an average risk of colon cancer should have a colonoscopy every 10 years, a double contrast barium enema every 5 years, or a fecal occult blood test every year. Additional options are sigmoidoscopy every 5 to 10 years. People with certain risk factors for colon cancer may need screening before age 50 or more frequent testing. Such people include those with a family history of colon cancer, African Americans, those with a history of previous colon cancer or polyps, or folks with a history of ulcerative colitis or Crohn's disease, which are both chronic inflammatory bowel diseases. The death rate for colon cancer has dropped in the past 15 years, and this may be due to increased awareness in colon screening. In general, early diagnosis can lead to a complete cure.
Colorectal cancer is the third most common cancer in the U.S. It has few symptoms in the early stages, and it's the second leading cause of cancer death among men and women. However, with early detection, colorectal cancer is among one of the most treatable cancers with high survival rates. The American Cancer Society guidelines for colorectal cancer screening recommend that average-risk individuals from the age of 50 undergo some type of testing schedule. Yearly screening with a fecal immunochemical test, such as the Insure is one of the recommended options for colorectal cancer screening and can help save lives. The Insure test is a simple and highly effective option for colorectal cancer screening that works by detecting blood in the stool. The presence of blood may be a sign of lower GI disorders or colorectal cancer. This test is non-invasive, does not require handling of the stool, and may be completed in the privacy of your own home. In addition, this highly sensitive test is not affected by any foods or medications, so you may continue to eat normally and take all your medications without any restrictions or alterations. Always carefully review all enclosed InsureFit patient literature for detailed instructions, storage conditions, and other precautions before performing the test. This test detects human blood in your stool. There are many gastrointestinal conditions that may cause blood in your stool. If you receive a positive test result, more testing and evaluation by a physician is necessary. This test does not replace your regular physical or rectal examination by your physician. A negative test result means that no human blood was found in the samples. However, colorectal lesions, including some polyps and colorectal cancers, may bleed intermittently or not at all. Additionally, blood may not be uniformly distributed in or on the stool, and a test result may be negative even when blood or a lower gastrointestinal disease is present. For the most accurate results, do not perform this test under any of the following conditions: bleeding hemorrhoids or piles, blood in the urine, or blood is visible in the toilet bowl, during or within 3 days of menstruation, bleeding cuts or wounds on the hands, expired test card or damaged test kit components, salt water or rusty toilet water. If you have questions about these limitations or precautions, please contact your physician or healthcare professional. The Insure Fit Test Kit consists of a test card, 2 blue brushes, 2 blue plastic waste bags, instructions, and a reply envelope. Bring all contents into the bathroom when performing the test. Before starting the Insure Fit test, remove any cleaners or bluing agents from your toilet and flush twice to make sure these cleaners are completely removed. Now you are ready to perform the test. After your bowel movement, place the used toilet paper in one of the blue bags provided in the test kit. Do not put the used toilet paper in the toilet bowl and do not flush the toilet. Next, on the test card, lift the flap marked A or lift here for sample 1 to uncover a small white square. Set the card aside. Using one of the long blue brushes, gently brush the surface of the feces for about 5 seconds. If the stool is loose, simply stir the water around the stool. Remove the brush from the water and gently shake it once to remove excess water and any loose stool. Transfer the water sample by gently dabbing the brush bristles onto the small white square found under the flap marked A on the test card for about 5 seconds. Some staining of the white square may occur. Put the used brush in the same blue waste bag that is holding the used toilet paper and dispose of the bag in the same manner as your regular household trash. Clearly print your name, date of birth, and date the sample was collected on one of the labels located on the instructions for use or information form. Use the label to close and reseal the flap over your sample. A second sample must be taken from a different bowel movement. The test card may be stored at room temperature out of the sunlight until the second sample is collected. When collecting the second sample, repeat the process using the test card flap marked B or lift here for sample 2. An additional second blue waste bag and blue brush are found in the test kit. Remember to fill out the second label and use it to reseal the B test card flap. Place the test card in the return envelope along with any completed forms requested by your physician. Return this envelope to the laboratory or medical professional as soon as possible, as the test must be developed no later than 14 days after first sample collection. Congratulations! You have completed the test. Insure Fit is a simple, fast, and non-invasive option for colorectal cancer screening. Yearly screening with the Insure Fit test can detect colorectal cancer at an early, treatable stage and can save lives.